I mean, I know I'm on my own, I can't look after myself at home, so I've got to rely on other people to do it. Hospitals, of course, do the job they're there for, which is very clinical. Obviously, it depends on what you're suffering from. Of course, in my case, I prefer to be in a home.
So we know in care homes, patients there are 50% more likely to be admitted to hospital than an equivalent patients over 75 in the community. And these patients who have got carers, have got care plans, and should be looked after, and therefore the ones who shouldn't be going to hospital.
For a resident to be living in a care home, you know, they have such vulnerability. They often have multiple complex diagnosis. Lots of them are living with dementia. We try and work with the care homes to think actually what might happen, you know, and how can we prevent that from happening. If it does happen, what can we do so it's not a crisis? We've thought about it, we've planned for it, we know what we're going to do, and hopefully it doesn't mean the person ends up in A&E unnecessarily.
Admission rate to hospital for patients from care homes has gone down to 25% over the last 4 years. And this has meant a saving of £2 million just from improving the quality of care for patients and reducing inappropriate admissions to hospital, to secondary care. So it's been a fantastic win for the whole population because of the money being saved appropriately.
To work along with the GPs and especially with the pharmacist is really beneficial to us, to our residents, because we get the regular medication review, so we can, you know, manage the medications very well now. Sometimes the residents on a same medications for a long time, and if there is no proper review, that can affect the residents' well-being as well.
We know that the quality of prescribing for care home patients really did improve an awful lot, and overall last year we were the best in the country for prescribing certain drugs called anticholinergics. These are drugs that often can make patients more confused, particularly patients with dementia, and also more prone to falls as well.
I would go into a GP practice and conduct a medication review using the patient's record on the GP system. I would then go into the care home and conduct the medication review with the patients or with the care home staff, and in some cases the GP will come along with me and we'll do it in a multidisciplinary approach. So we look at their systems and processes in the care home, and we see where they might need some help or support, and we provide training. We've seen a reduction in problematic uses of multiple medications in a single patient, and we've also seen a reduction in unplanned hospital admissions.
Before there was no named GP and there was no weekly visit, you know, and it was difficult. The out of hours doctors are not familiar with our residents. First community is the dietitians, SOL team, and physio team, OT team. They are on hand all the time. If we need any referral, we can send the referral to them, we can talk to them.
It definitely is about patient-focused care and what the patients and the relatives and carers wish for the patients. So it's really taking on board their wishes. We discuss things like resuscitation, and for end-of-life patients, the place of death, and we know that our patients dying in their preferred place of death is now at 90%, whereas in the general population it's probably 40% or less.
It's been a fantastic journey working with the care homes, with the residents, looking after them in a different way than what we have done traditionally. We brought people with different skills coming together. They looked after patients holistically. Each one was able to contribute to improve the patient care, and that resulted in better outcome for patients. And actually it also supported the care home staff that they are able to look after the care homes residents in a better way.
Well, I only went to A&E when I first came here for the x-rays and the assessment of what was my problem. But I've not been back since, and I've had no need to go back since. And of course I'm very content here with the way I'm being looked after, which is very good.
The project is really breaking down barriers between different health care organisations, such as the providers, care home, GPs, commissioners, all working together for the benefit of residents in the care homes.